Doctor at Johannesburg's Mother and Child Hospital, who blew the whistle on the dire working conditions, has now been reinstated after a precautionary suspension. The suspension of Rahima Moosa Mother and Child Hospital's only pediatric gastroenterologist, Dr. Tim de Maayer, elicited widespread criticism by media professionals who dismissed it as a cynical act. We're now joined by the head of department at Paediatrics and Child Health in Gauteng Health, Professor Ashraf Coovadia, to discuss how the authorities are dealing with complaints by healthcare workers. A very good evening to you, Dr. Coovadia. Thank you for your time. Dr. de Maayer's open letter, it gave us insight into perhaps the awful state of affairs at the Rahima Moosa Mother and Child Hospital. Now, some critics, some in the health space, have said that they don't believe that going public should have been the first course of action for healthcare workers, or should be for healthcare workers. But in Dr. de Maayer's case, it was a method of last resort, wasn't it?
Yes, it was certainly not the first method of raising the issues. And I would never support that being the first way of dealing with matters. It must be dealt with internally through the processes, through management and the normal processes. And I believe that was done in this case.
A meeting has since taken place with the health MEC, Dr. Nomathemba Mokgethi, which she described as a fruitful one. What is your view?
It's fruitful in the sense that the MEC afforded him the opportunity to state what the reason was for going public on this, allowing her to get information and detailed information about why it was that he went public, and understanding, and I think she totally appreciated the desperation he felt and that led to this action. Other than any other reason, there's no other motive for a doctor to talk about what happens at an institution. It's very hard and tough. So I think it was fruitful in the sense that once she had appreciated the gravity of, or the challenges that is faced not only by Dr. de Maayer, by healthcare professionals in bringing this through the channel of communication, which is a challenge we have in the province, and in how we deal with this. Then there was a decision made around, was this in the best interest of the public and patients, or in the institution, or in fact in Gauteng Health, to suspend such an individual who brings these things to light. What was fruitful was also a discussion around how, as healthcare workers, we have a channel of communication to the MEC so that we don't have to run to the media. It's not what we choose to do. I appreciated that, and I appreciate that openness and that open line of communication with the MEC and with the Gauteng province. What remains to be seen is how we build on that and how we continue to strengthen those lines of communication, whilst at the same time, and she was clear about this, this is not about saying to doctors what you can and you don't have a right to talk about these things or raise these things. We have to reserve the right as healthcare professionals to be advocates for our patients. I appreciated that very much, and I think in that spirit it was very fruitful. The spirit in which that discussion happened. I was left with confidence that we can build from here.
Yeah. The death of a 13-year-old patient whom Dr. de Maayer had treated for years at the hospital, and other unfortunate situations that parents and children go through due to the state of the hospitals, prompted his open letter. I mean, you make mention about the lines of communication now being open, how you appreciate that bit as a good startup. What sort of intervention is the MEC proposing?
So the MEC, I think, first of all, was critical in resolving this immediate crisis, and I think we totally appreciate that. I'm most grateful for that. And I think we need to support her in building the relationships between healthcare professionals at all levels, at ground level, with the officials at the Gauteng Department of Health, not just with our CEOs. We work with our clinical managers all the time, but at central office we have there's almost there's just hardly any contact, and I think we need to build that contact. I think, and that's squarely in the ambit of the MEC to help make sure that those relationships exist and that there are open lines of communication so that no doctor, no head of department, no nurse, no healthcare worker who feels that they need to raise issues needs to feel in any way intimidated or held back. Of course, they must follow the lines of communication within the institution, but they need to know that there is that they can escalate matters when issues are of such gravity as what Dr. de Maayer depicted. These are issues that are not of the CEO's making. These are issues that have been there for a long time. I think we need to acknowledge that these are problems that have existed and continue to exist with successive heads of departments in Gauteng Health, successive MECs, and it's a failure on the part of us as a province. It's a failure on the part of all of us in this province of Gauteng to get our healthcare system working. The richest province, the most blessed province in terms of finances, human resources, academics, but we are failing to deal with the challenges. The challenges are there. The MEC has acknowledged that. And they are there. They are real challenges. Those can't be fixed overnight. However, what the MEC can do is open, and she has, I believe, opened the lines of communication with the university, with healthcare professionals. I felt encouraged by that posture.
What do you think this has now done for the morale of staff? Because, I mean, these issues that Dr. de Maayer raised in the public domain, as you make mention, were issues that were raised with management and Gauteng Department of Health for years on end, and there was absolutely no progress that was being made.
On the one hand, I think many might still be fearful that should they speak out, then they may get suspended. That's a real fear amongst healthcare professionals, and that was why I was really good, and I think many of us have been gravely concerned about how that happened, because it sends a message that you speak out at your peril. On the other hand, the fact that there was overwhelming public support from all quarters around the fact that what Dr. de Maayer did was an act of bravery in the face of deteriorating circumstances at the hospital that have been there for a long time, that have been there for many years, and that it is no one person's fault that these things are happening, but that that people can see that he was acting as an advocate for children, and more individuals, hopefully more younger doctors and healthcare workers, nurses, get inspired by that degree of activism and say, this is what we need to do to save our patients. We have to speak truth to power, as we used to do in the days of HIV, when we spoke to government about their misguided policies around HIV/AIDS, and fortunately they turned around. I believe we have an opportunity now to speak truth to power without fear, and I believe that the MEC has got the intention and every willingness, and has certainly got willing partners in the healthcare providers across the platform, will work with the Gauteng Department of Health, provided they are not treated the way Dr. de Maayer was.
As you raise, the views and the perceptions that now this creates, and how it motivates the others to also stand their ground and speak up to improve the health system. We know, based on the letter, the open letter, which was an article, that the state of affairs is really a shocking one, and it has had a detrimental and sometimes fatal effect on children's lives. How do you think now this is viewed by the public who has not had much faith in public hospitals and doctors working at public hospitals and nurses and healthcare workers? What sort of perceptions do you think this sort of stand now, creates in the minds of those who have been skeptical with evidence, with truth, about how doctors at public hospitals conduct themselves?
So I think, let me just start off by saying that hundreds and thousands, if not millions, of patients going through the doors of Gauteng Department of Health are being treated in the most excellent manner by all of our healthcare wonderful professionals across the platform, including at Rahima Moosa. They are getting an excellent service. This does not take away from the fact that there are problems and that there are serious concerns, but that doesn't mean that the moment a patient walks into Rahima Moosa, they're going to get terrible treatment or they're at risk of dying. So let's separate those two things. You will get excellent treatment at Rahima Moosa. However, they are the working conditions and infrastructure and so on is working against professionals trying to do the best they can, so that it hampers us giving the best and optimal responses, and certainly does affect our ability to save lives. And so, I think I wouldn't say to people, please don't come to Rahima Moosa. I wouldn't say that. But I would also understand patients' worry about, well, if I do go to Rahima Moosa or one of the other public hospitals in Gauteng, I might get treated well, but when, what if I get an infection in the hospital? What if there's no lights at the time I'm there? What if there's no water when I'm there? Those are real concerns of patients. And I don't know what to say to them, but to say we're doing the best we can. What I'd like to say is that I believe that the province is also trying. They are trying under enormous challenges. Some of these things are beyond even the Department of Health. For instance, the water issue. These are beyond the Department of Health. However, that does not excuse the department from making alternative plans for water, other ways to get electricity sorted out. These problems are so huge, they're in a way beyond what our Department of Health can even do. And we need the Premier, we need the Provincial Department of Health, the Gauteng province, the Premier, to realize that there's a crisis. I think if we even use the word crisis, we begin to start addressing them. But if we say that, well, these things have always been there, they are there, we appreciate that they're, we know that they're there, we're not going to take the posture and deal with the gravity of the situation in the manner it requires right now.
Yeah, very well. Thank you so much for your input. Thanks for weighing in on this discussion. Head of Department of Pediatrics and Child Health in Gauteng Health, Professor Ashraf Coovadia, speaking about the reinstatement of Dr. de Maayer.